Welcome back to part 2. It's still me, Dr. Babes, and join me as we continue to discuss more about your acne concerns. In our previous video, we discussed what causes acne, some lifestyle changes, and the notable ingredients that you need to treat it, which you can find on over-the-counter products or skincare products. If you haven't watched the first part, you can click the link below and make sure to check it out. So let's move on to the prescription category. For most deep and cystic acne, topical treatments are really not going to cut it. Now, most people get a little bit disheartened when they hear that because sometimes, no matter how perfect your over-the-counter skincare routine or your lifestyle interventions, or no matter how amazing your diet is and you'd never look at pizza or dairy again in your whole life, you still get deep and cystic acne so severe and so long that you'd like to ask it to pay some rent.
Getting real tired of you ducking me, man. Yeah?
Oh my God!
Yeah. Getting really tired. Where's my money? Where's my money?
And you're still going to need prescription treatments. Now, why is that? Well, it's your parents' fault. Don't blame me, blame them. Kidding. Jokes aside, genetics are a major determinant of not just how many oil glands we have, but their activity and the specific type of stickiness of the oil you secrete. So there's no shame in needing to go see a doctor or dermatologist for your acne. It doesn't mean that you're doing anything wrong. And it is a better way to go there early than try hundreds of products, which could potentially worsen it. So what prescription options do we have to help acne? So let's start with the topical ones first. First off is clindamycin. And this is slightly more heavy-duty of an antibiotic that targets P. acnes and can be used alongside benzoyl peroxide. Then, we have prescription retinoids, and these are the things like tretinoin of various concentrations, adapalene, and as well as tazarotene. All of the same benefits we talk about over-the-counter retinoids are applicable here, including reducing the buildup of dead skin cells in your pores, exfoliates your skin, and increase collagen production. Except that the concentration is even higher. And that means that the anti-acne effect is stronger, but also that those potential side effects of flaking and inflammation can also be worse. So make sure you're using a tiny amount and maybe use it every other night for a few weeks until ultimately you want to aim for every night. Prescription creams can also sometimes combine multiple of these ingredients together. So a great example is Epiduo, which combines adapalene and benzoyl peroxide, making it easier to use in both your regular routines. And then there's also Benzaclin, which is a combination of benzoyl peroxide and clindamycin. And finally, we have some newer prescription creams such as Axone, which is a topical dapsone, something which is anti-inflammatory and has an antibacterial effect. And even more recently than that, we have something called Winlevi, which specifically targets the hormone receptors on your oil glands. And so it's a great option for people with hormonal acne. So that is all the prescription creams, which is not sponsored by the way. Now lastly, we have to talk about prescription oral tablets. The reason tablet medications work better than topical medications is simple physics. Tablet medications are taken through the mouth, absorbed through the gut, and delivered in your bloodstream deeper into their skin. So no matter how good your skincare regimen, it may not be getting absorbed at the right strength to make a huge impact when it comes to deep cystic acne. Don't get me wrong, it's going to help on the peripheries. Maybe you'll get a reduction of about 10 to 20% of your severity. So there are 3 main options for these. Starting with number 1, which is oral antibiotics. Doxycycline is by far the most popular option for this. And the way I want you to think about it is that if clindamycin and benzoyl peroxide targets the bacteria on the surface, kind of like shooting bows and arrows at it, and then taking doxycycline as a tablet is a little bit like blowing up a dynamite under the surface. It is far more effective at reducing the amount of the activity of P. acnes and therefore, it does a great job of reducing acne severity. Doxycycline is also independently anti-inflammatory aside from its antibacterial effect, and so it can give amazing results when you're taking it. However, because of the side effects of taking long-term oral antibiotics, including on your gut bacteria, you can only take doxycycline for about 3 months. And although it's very effective while you're taking it, there's actually no long-term benefit when it comes to acne reduction once you stop. So moving on to tablet option number 2, which is hormonal targeting treatments. These include oral contraceptive pills, which reduce the amount of hormone surges in your body, and something called spironolactone, which blocks the hormone receptors on your sebaceous glands. What that means is that no matter what's happening with the hormone levels in your body, it's not communicating through your skin. Androgen hormones like testosterone normally attach to the specific receptors on the sebaceous glands and tell them to produce more oil and to produce thicker and stickier oil. This dramatically increases your chances that you're going to get a blockage in your pores, and therefore, you're going to get really severe acne. This is why classically acne is at worst during puberty, because that's the time where you're having surges of these androgens. Now, both of these hormonal targeting medications are only really an option for biological females. Otherwise, it causes a lot of unwanted side effects in biological males, like enlarged breasts. Unless And let's move on to oral medication option number 3, which is isotretinoin. If we mentioned bows and arrows earlier as well as dynamite, now this is the big nuclear weapon in the fight against acne, the treatment to end all acne treatments. Isotretinoin, or also popularly known as Accutane, is a part of the retinoid family I talked about earlier. But rather than being a cream which is specifically applied to the skin, isotretinoin is taken as a tablet. And because of that, it is absorbed throughout the body. Now, the plus side of that is that isotretinoin is by far a million miles the strongest and most effective treatment when it comes to reducing acne severity. It reduces the size and activity of oil glands permanently, meaning that once you have a complete, roughly 5-month course where you take the tablet each day, your acne will be improved for life. The majority of people who take isotretinoin will never need more than 1 course in their entire lives. But the downsides of it being absorbed as a tablet is that it can have side effects on things like your cholesterol or your liver and other parts of your body. We have discussed a full separate video about Accutane in the past, focusing on all of its benefits and side effects. But for now, just know that it is an endgame of acne treatment offering potentially incredible results, but with the risk of side effects, and therefore requiring a lot of blood work. You need to come in every month and get a pregnancy test done, and so that the whole process can be a bit tedious for those 5 months that you're taking the medication. Overall, trying a tablet medication has a lot of potential positive outcomes. And yes, some potential side effects too. And it's the job of us doctors to tell patients about these side effects. And then we decide together whether or not it's worth it for each individual patient. And that's it. Don't worry if you got too overwhelmed with all that data. You can always pause or rewatch the video for you to digest and absorb all that information. There are tons of products and treatments available nowadays, but that is every acne treatment in the world that is worth knowing. Dear Acne, I think I've popped you enough to let you know that I don't like you. P.S. Get out of my face and in my life too. So here's a recap and a guide of what specifically you should do depending on the severity of your acne. If you have whiteheads, blackheads, and slightly oily skin, you should use a salicylic acid-based cleanser in the morning, and you should use the over-the-counter retinoid product at night. It's also a good idea to keep a benzoyl peroxide spot treatment around you in case you get that odd angry bump. After 2 months of this regimen, for this type of acne, you're usually really well controlled. If your acne persists even though you're doing this, and if you have deep acne from the beginning, which causes pigmentation or mild scarring, then you should really go see a dermatologist and discuss prescription options. They're likely to give you a prescription antibiotic cream in the morning and a prescription retinoid at bedtime. If you have severe cystic or scarring acne, then go to your dermatologist and they will likely give you an oral medication, whether that is a short-term oral antibiotic course or a hormonal targeting treatment, or whether it's isotretinoin right from the beginning depending on your severity. And my last, most important piece of advice is that if you have severe acne, I'm begging you, don't try 50 different over-the-counter creams. They're not going to fix severe hormonal or cystic acne, despite what the skincare companies say. Because honestly, they will advertise this insane before and after photos where someone goes from severe hormonal acne to clear in just 1 month using a night cream. That is ridiculous. You didn't get the acne overnight, and it's not going to go away overnight too. You have to be patient. This is science, not magic.
Protego, you may begin. Accio, Flipendo, Descendo, Avada Kedavra!
Now again, I have kind of gone through all the most common and most evidence-based treatments for acne. Every single one of these really deserve their own video, so we can go through them in much more detail. But I hope that this acted as a useful summary of everything that is out there. If you have any other feedback or questions, leave them in the comments below. Don't forget to like and subscribe for more tips and medical advice. Thank you so much for watching, and I will see you in the next one. This has been your good doctor.
To proceed with free online consultation, click the link in the comments section.